Dental implantation is the most cutting-edge method for restoring lost teeth. The procedure is performed under local anesthesia. CBCT allows for precise surgical planning, taking into account key anatomical landmarks. Using a scalpel, an incision is made along the center of the alveolar process in the area of the missing tooth and an intrasulcular incision extending to the midpoint of the crowns of adjacent teeth. A periosteal elevator is used to dissect a full-thickness mucoperiosteal flap in the same area. A physiodispenser is used to drill the bone and place the dental implant. Dental implant systems vary, and the design and markings of drills differ among manufacturers. To minimize bone trauma, drilling is performed from a smaller to a larger drill diameter at the same predetermined height. Sequential drilling is performed with a speed reduction of 100 to 200 RPM. The implant is inserted into the implant site at low speed. To seat the implant to the appropriate depth, a torque wrench is used to gradually advance the implant into the jawbone. Next, a guide pin is inserted and a bone profiler is used to reduce the bone above the implant to allow accurate placement of the healing abutment without contact with the bone. After removing the overhanging bone margins, the dentist inserts the healing abutment. The wound is sutured. Osseointegration occurs within 3 months. After 3 months, the prosthodontist replaces the healing abutment with a permanent abutment. Impressions are taken, and a permanent crown is fabricated in a dental laboratory. The completed crown is secured to the abutment.